And on to the country's daily COVID-19 update. Nakuru County, for the second time, recorded the highest number of the new COVID-19 infections after Nairobi, amid rising concerns of an increase in community transmissions. The latest figures by the Ministry of Health, Nakuru is leading with 86 new cases, while Nairobi is second with 84 cases. The number of new infections also climbed after 388 more people tested positive for the virus in the last 24 hours.
In the latest data by the Ministry of Health, the number of new COVID-19 infections in Nakuru continued on an upward trend, with the county recording the highest number of new infections in the last 24 hours. This is the second time in the last week that Nakuru is reporting the highest number of new infections, amid warnings by the Ministry of Health against violating the COVID-19 protocols and the threat of community transmissions. The latest figures also indicate an increase in the number of new infections after 388 people tested positive in the last 24 hours, from 4,287 samples tested, bringing the total number of cases since March 13th to 41,546. Kenya's cumulative tests now stand at 591,198. From the latest cases, 5 of those infected are foreigners, while 383 are Kenyans. Out of the new cases, 284 are males and 104 females, with the youngest being a 4-year-old, while the oldest is 85 years. Over the last 24 hours, in terms of distribution, Nakuru was leading, following by Nairobi. Others are Mombasa with 51, Trans Nzoia 49, Kiambu 29, Kisumu 17, Kericho 11, Meru and Busia 10 cases each, Bungoma 8, Machakos 7, Garissa 5, Kajiado, Tharaka Nithi and Nyamira 3 cases each, Nyeri, Siaya, Makueni, Nandi, Kwale and Nyandarua 2 cases each. At the same time, 63 people have recovered from the deadly disease, 40 from the home-based care program and 23 discharged from various hospitals. The total of those who have recovered has now increased to 31,000. The death toll has also increased to 766 after 6 more people succumbed to the virus. For Channel 1 News, I am Emily K. Bade.